a little health and a little wealth and a lot of love.
Doctors misdiagnosing, dismissing, even gaslighting their female patients.
I heard everything from "you're just tired" to one doctor actually said, "Well, I think it's just because you have your period."
I was told that I was overweight, I needed to lose weight, that I was depressed and needed therapy.
For 4 years, Maria Garcia suffered from intense stomach and back pain, but says her doctors told her there was nothing wrong. She just needed to slim down. When her symptoms escalated, vomiting, weakness, and hair loss, she says her specialist still dismissed her.
Being an overweight Hispanic woman was to my detriment. Everything could be attributed to either me being dramatic, exaggerating, and being fat. You've got nurses that work...
Studies showed bias against women, especially those of color, is a problem across healthcare, from treatment to research.
Most of the data that we use today in medicine is based on research on men, male animals, or male cells, which is just shocking.
Pause a second about that. Repeat that, because much...
Wow, that's right in line what we've learned in the conference. So Emily, MD, well, first, the two things. One thing is that the title of this is they gaslight. You're not going to see that. If you are joining us on our YouTube, you actually will see that. So gaslighting women in healthcare, I believe that's right?
That's the name of the video maybe that we use, but the title for today's episode is How Medicine Fails Women with PCOS.
Wow, how medicine fails women with PCOS.
And a lot of this is involved. I think a lot of women with PCOS, they have the diagnosis or they don't even know that they have PCOS. A huge percentage of women in the U.S. have PCOS and don't know they have PCOS. And so I think it's important to know that this is a subject that I feel like it kind of falls through the cracks. So you have endocrinologists, you have OBGYN specialists, and you have primary care. And I think those are the three people or the three specialties that really are responsible for treating PCOS, but I don't think anyone really knows whose wheelhouse it's in. And so sometimes it's kind of like a hot potato. And as a primary care physician for the last several years, I feel like that was very evident because I would have patients come into my practice who said, I'm seeing a gynecologist, I'm seeing an OBGYN, I'm also seeing an endocrinologist, but I'm unhappy with my care. And I'm not saying that that's at the fault of the specialist, but I think that traditional, conventional medicine only has so many options, and a lot of women are unhappy with those traditional options. And there's a huge lifestyle component. We'll get into that later. And I think a lot of conventional, traditional doctors know that there's a huge lifestyle component, but they don't necessarily have either the knowledge base or the time to give that education to the patient, to really sit down and get to the root cause or figure out how to help them completely transform their lifestyle.
Yeah.
And I think the gaslighting is real, especially with patients who see someone who might not be as familiar with the treatments or the newest studies that have come out with PCOS, the patriarchy in healthcare. And I'm not saying male doctors aren't sensitive and don't know what they're doing. I'm just saying that if you are a male, you haven't had that experience, you don't really know where women are coming from when it comes to, abnormal periods or infertility or a lot of the side effects that go along with that. And so I think it's important to be sensitive and empathetic, knowing that you probably have never been in that situation before.
Yeah, I think that's fair. And so one thing you said around endocrinologists, OBGYN, all these other specialties, why do you think it is such a hot potato? Is it like lack of resources and time, which we know all specialties are dire need because they just don't have time for each individual patient? And that's not the right answer, guys. I'm just being honest and real. Or is it too intrusive? Is it an end-to-end kind of thing? Is that why?
I think there's a focus on symptom management in
Not root cause.
in
it.
in conventional medicine. And so the symptoms of PCOS, there are medications that might help with those symptoms, but they don't necessarily get to the root of the problem and help. It's very much a vicious cycle, and it's a constant, it's constantly putting gas on the fire unless you are willing to significantly change your lifestyle habits. And I think a lot of women are desperate and they're willing to. There's so much information out there, especially on the internet and social media, that they don't know what information is reputable and what they can follow.
Yeah, you're right. You're right. That's interesting. I'm processing that. I'm just trying to understand exactly, what folks would have questions about that. But,
And I think
we'll talk more about it later. I don't want to steal your thunder, but go ahead.
Yeah, I think it'll be more understandable as we get through today's episode and we talk more about
Right. Okay. That's what I was thinking about.
Yeah.
Should I ask the question, treatments and all that? But I know we're going to hit that later, so I don't want to get that right away, right out the gate. Okay. Well, we have two other segments. Our other segment is the Bumfuzzle Battle. Mm-hmm. And we have two more segments because we do 30-day challenge and someone didn't do their songbird. All right. So a Bumfuzzle Battle. Cue music. Bumfuzzle Battle!
So, Bumfuzzle Battle, our word is Hirsutism. What do you think that is?
It's a diagnosis of symptoms with overactive ovaries? I don't know. I'm a shot in the dark here.
I mean, you know kind of what we're talking about today or getting at, but hirsutism specifically is the symptom of abnormal hair growth, and specifically in women, abnormal hair growth that is more of a male pattern. So you have extensive growth along the jawline, maybe what we call the happy trail, so on the lower abdomen, and other areas of excessive growth that you wouldn't expect, maybe extensive dark hair growth on the arms. And this isn't just a couple hairs here and there of a little bit of a mustache or chin hair. It's extensive, dark, thick hair growth in women.
What causes that in particular?
Generally, it's from androgen excess testosterone, for example.
Gotcha. A fun fact about PCOS, this is one thing I do I had a mental note and I stored it for later. They said at the conference that in earlier times, women who had PCOS were leaders in their tribe, in their groups. They're more aggressive, they're more athletic, they could build more muscle. So it was pretty much reveled. I'm not sure if I said that right, Emily, MD, keep me honest. But that's pretty much what they said. Like they were leaders. So if you do have PCOS, you are a leader, natural born leader. Back in the day, you were one of those, not in all cases, but they said, look at it like that. Instead of looking at something negatively, it actually is something that was positive back in the day, which I find fascinating.
Yeah, one of the speakers was talking about the edge that people got in the
better way of saying it when I was saying it.
They had a little bit of excess testosterone, and so they tended to be a little bit more aggressive. They had more muscle mass. They were the leaders of their pack, and it shows that there is a genetic component, but there's also a huge environmental component. And so back then they weren't exposed to the same things that we're exposed to, and it didn't create such a significant disease back then that it does now. And she'd also mentioned even Olympic athletes tended to have slightly higher testosterone levels. So the higher testosterone in general can potentially give you an edge. And there are many people who abuse exogenous testosterone, which we don't even have to get into. But this is something that she'd mentioned can be empowering for her patients, that there is a chance, there's a possibility that you can change the narrative, and this you can use this
Exactly.
as an advantage instead of thinking
Exactly.
that you're completely doomed.
Exactly. So it's something that it's an opportunity to look at differently. You know, we don't have that disease, so I don't want people to say, "Well, what do you know? Like, I struggle with this." We get it. We understand, at least from the friends and family who have it. But this is something to think about. This was absolutely discussed in the conference, and just something to look at it differently.
With a little health and a little wealth and a lot of love, that's the life that we live. Suits and scrubs.